people with hand eczema often need, we are definitely in need of more options. They could be very recalcitrant to treatment, and they're not all the same phenotype. They're a pretty heterogeneous group. Some people have hand eczema due to atopic disease, some have it due to allergic disease, some irritant, and many are a combination of those factors. And so having multiple treatments and trying to figure out which treatments would be best and which phenotype is something that hope will evolve with further research. In terms of opportunities for treating patients with atopic dermatitis, I think there are different areas of need. The first would be an oral agent that has really a clean label, and I think there are exciting treatments that will try to address that, such as the STAT6 inhibitors, potentially an ITK inhibitor as well, and some other novel mechanisms. We also have needs for biologics that have less frequent dosing as well. That is an area that can improve patient care. New mechanisms. So even though we have great treatments in IL-4/13, JAK inhibitors, anti-IL-31s, we're always looking for new mechanisms when those options fail. And lastly, can we create more effective treatments? So with these bispecifics, the trispecifics that are in development, can we push the efficacy limits that we currently have with our options right now? So there's a lot to be excited about. We still have a bunch of unmet needs, but I think the pipeline is addressing all of those unmet needs. So currently we have only one FDA-approved treatment for vitiligo in ruxolitinib cream, which was approved back in 2022. And there's limits on the label for 10% or less body surface area. Well, we really do have needs for systemic agents. And it's exciting that we have 3 JAK inhibitors that are in late-stage development, and I'm optimistic all 3 will ultimately get approved. We've already had press releases from upadacitinib as well as povorcitinib, and ritlecitinib will hopefully announce the not-too-distant future as well. And those all seem to be positive and will help with our therapeutic armamentarium for patients with vitiligo, those who have more active disease getting new lesions, those who have large body surface areas, or those who really aren't amenable to using a topical. And then there are other agents as well that are even earlier in the pipeline that are more targeted that I'm also particularly excited about.